All vets have two-dimensional X-ray systems, but the problem with this is it gives a fundamentally limited view of 3D bodies. The diagnosis can be difficult because you have overlapping bones and overlapping teeth, which makes it hard to see what's going on. 3D imaging is available in the form of CT and MRI scanners, but these are much more expensive. And you need a whole extra room to put them in, and you need shielding and three-phase power, and in the case of CT it's a much higher dose. Whereas here, with the device behind me, we've got a 3D imaging system that can go into an existing vet's radiology room and give you 3D images from a device that you can lift up and put on the existing table. Here's an example of a spaniel's elbow. And in 2D, it's quite hard to see what's happening with the elbow because you have the overlapping humerus and it's got the ulnar bone underneath it. Whereas when we have our 3D images, we get a stack of slices that we can go through. So here we can see the ulnar, and then we go up a little bit higher, and you can see that the humerus has a little crack in the end of it. And this could be pinned and give the dog a good chance of recovery, whereas if a fracture like that was missed, there's a chance that it carries on using it and you end up with a more catastrophic break to it. Here's a 2D image of a cat. The skull is very complicated to image because you've got lots of overlapping chambers, you've got both sides of the jaw overlapping each other, so it makes it very hard to see what's going on. Whereas when we can see that in 3D, we can see each side of the jaw separately, so you get a nice view of the joint between the jaw and the rest of the skull, and we can scroll through and see each side of the jaw in good detail. We can see the roots of the teeth, just as you would a stack of coronal CT slices. As well as being very useful for looking at fractures and bony structures, it's very useful for dental imaging. And dental imaging is quite difficult to do because normally you put a little 2D X-ray plate in the mouth and you have to put that in 4 or 5 different positions. It's quite a highly skilled job, whereas with our 3D imaging, you can just place the cat or dog's head on the detector and then scroll up and look at each side of the jaw separately, which makes it a quicker and easier process to do. With rabbits, you don't have the option of using an intraoral detector because the mouth is just too small, and it makes the image very difficult to see because you've got these 2 sets of overlapping teeth, making it very hard to see. Whereas with our 3D imaging, we can scroll through and see one set of molars and then scroll through to the other side and get a clear view of the molars on the other side. Also very good for exotics, which often have lots of small, fine overlapping bones. In 2D, that makes a bit of a mess, whereas with 3D imaging, you can scroll through and see each layer of bones separately on different depths.